My name is Maddie Pascavis, and I have been working with Dr. Castro, Dr. Lee, and Marilyn Arai on an early detection method to monitor kidney health. This technology is known as ELA. First, we had to identify the issue at hand. Acute kidney injury kills up to 2 million people every year. AKI is a collection of various syndromes, making the criteria for diagnosis uniquely difficult. The current method for diagnosing AKI is measuring serum creatinine levels in the blood. The issue with this is that serum creatinine levels are only elevated enough for detection after 50% of functional nephrons have been lost. So, our idea is that we want to detect two biomarkers of AKI, N-gol and KIM-1, using a urine test. Measuring the levels of these two biomarkers would allow for the detection of AKI before any loss of function has occurred. This would be done through a lateral flow assay, producing results in 15 minutes. The LFA would have a test and control line. The emission would be measured at both the test and control line, and then ratioed to produce a number corresponding to low, medium, high, or no risk of AKI. Two lanthanide doped up-converting nanoparticles are used. Erbium is used in KIM-1 detection, and toluene is used in N-gol detection. Erbium gives off a green emission, and toluene gives off a blue emission under infrared radiation. My co-op experience has had both an impact on the field of medicine and research, but also on me. In terms of medicine, our device would be used at home to increase access to those without it. The increased access to testing kidney health would reduce the economic and physical burden of chronic kidney disease and end-stage renal disease, both progressions from acute kidney injury, in large part due to lack of early diagnosis. Additionally, you would see better prognoses for cancer patients, as AKI is a very common chemotherapy complication. In terms of personal impact, my co-op experience reaffirmed my interest in cancer. I had never worked in a lab before, and seeing the process of an idea coming to life was amazing. I loved understanding the reasoning behind each experiment we ran, and learning how to understand our results and determine the next steps to take was so fascinating. I loved learning about nanoparticles and how their use allowed us to make a bigger impact on cancer. I learned how to communicate my progress effectively in lab meetings. I gained so many skills, like ELISA, how to conjugate different shells and antibodies to nanoparticles, and how to treat and interpret data. This hands-on experience in cancer research has made me even more passionate about oncology, medicine, and now research. The most valuable experience I will take away from this co-op, however, is the community I found in the lab. I learned so much from those around me, and everyone took the time to explain not only the techniques to me, but also the science behind them. The community that exists in research is so special. I remember seeing people take the time out of their days to help each other out, whether it be discussing a project or running an experiment for each other. Everyone really worked together to help each other succeed. That collaborative environment is something I really cherish and showed me the kind of work environment I hope to be in. I hope my future co-op will expand upon the research skills I have learned while also having some clinical aspects.